The list sort of sadly goes on and on. I mean, one of my favorite examples is a drug called pembrolizumab that is now used for dozens of cancers. But initially, it was first developed for melanoma and for lung cancer. And actually, the work that we did in my lab, I guess this is 2016, and it was actually simple work. A patient came to us in 2016 with metastatic angiosarcoma, which is a horrible form of cancer. And his doctors told him that he was out of options. And we did something really simple. We went on PubMed and looked for like angiosarcoma treatment. I mean, it was that simple. And we came across a paper from 2013 where a researcher had looked at 5 tumors from 5 different patients with angiosarcoma, and 4 out of the 5 tumors had increased expression of PDL1, which is a marker that you might respond to a PD-1 inhibitor. And so even though the paper was published in 2013, and this gentleman came to us in 2016, and of course hundreds of people had died in the previous 3 years, no one had ever actually tested whether a PD-1 inhibitor could be useful for angiosarcoma, even though, again, it was a laboratory study published 3 years earlier, but no one had ever translated that insight into using it in a patient. So we treated Michael as the first patient ever that we're aware of with a PD-1 inhibitor, and he responded so incredibly well. A couple of things happened. One is that his doctor started prescribing it to all patients with angiosarcoma. It turns out it works in about 18% of patients. So it was a uniformly fatal cancer within 1 year. Now about 20% of people will live beyond a year, and it can be really transformative. So it changed clinical practice for angiosarcoma. The other thing it did, specifically for Michael, is that it has put him into now a 9-year remission. Just last month, he walked his daughter down the aisle on her wedding day in Nashville, Tennessee, 9 years after he was told that this is it. And so these drugs are out there, and sometimes there's even breadcrumbs. Like, it didn't require any brilliance from my lab. We literally just had to find a study that was published 3 years earlier, and that again is really what drives us with this work now, to say, can we find all these breadcrumbs? Can we put them together, and can we make sure people actually benefit from all the great science that's being done all over the world? Let's actually translate them into patients.
Yeah, it seems to me that PubMed and other sources of science knowledge are great for stacking papers, and they're pretty decent in terms of how they're organized, by keyword search. I mean, they're not perfect, but you can find stuff.
Yep.
And you get suggestions about related articles, and somebody with a little bit of time and energy will get some degree of information there. But it seems to me that no one has really organized the enormous database of information about science as it relates to disease. It occurred to me a moment ago, there should be a database where one can enter whatever knowledge they have about how old their grandparents were when they died and of what, how old their parents are or were, maybe they're alive, maybe they're deceased, any knowledge, any kind of family history. This is the first thing a doctor would ask you. If I come in and you're the MD, and if I say, hey, listen, I've got like this swollen lymph node on the left-hand side, I don't think you're going to say, hey, like, go get it scanned. You'll say, any history of blank and blank in your family.
Exactly.
First thing, right? Yep. One should be able to do this from home and then enter any symptom profiles they might be having, and with the appropriate cautionary notes, get some ideas back about what might be going on. Now that might sound like, oh, this is people playing their own doctor, but I'll tell you right now, if I put in left armpit lymph node pain or swelling into any online search engine, it's going to tell me some of the worst possible outcomes. So it's not like we need to shield people from potential outcomes. But it seems to me that this should be pushed through an AI read of PubMed, which already exists, right? Most of the large language models are trained on the entire internet, including PubMed, and that it should point somebody in some actionable directions, including which of these groups, I meant to ask this earlier, which of the various groups for a given disease is the best one?
Yeah, exactly.
Like if somebody's kid, God forbid, has a blood cancer, which group do you go to? Is there a best one? Are these rated by anybody? I mean, I'm not trying to throw our arms around all of medicine here and all of the problems in the world, but it seems to me that all of this is tractable. Someone just needs to get organized about the databases.
I completely agree. I think that there's such randomness to healthcare and to our biomedical research system. I think that's probably maybe the most heartbreaking part of this all, is that because it's so random, Michael gets a drug and he walks his daughter down the aisle 9 years later, and a bunch of other people don't get a drug and they aren't alive. And so I love the idea of that centralized database. I think that There's a company called Open Evidence, which is trying to basically create a GPT, but for healthcare. I don't know if I don't think it's to where you described it, where you can really put in your personal family information and get answers. But I'm hopeful that others will. The role that I see our work and my work fitting into that is basically finding as many of these connections and proving them out in the lab and in clinical trials as possible. So that way, when you type in your disease and your situation, that drug that we worked on, rises to the top, because it wasn't just a connection in PubMed.